Well, good afternoon, everyone, and welcome to the COVID-19 update for Tuesday, November 3rd, Election Day, the last day to vote in the 2020 elections. Here in Illinois, we made this year's Election Day a state holiday for K through 12 schools and for public universities. As a result, local election authorities that use schools and college buildings as polling places have less foot traffic in and out of those facilities, another effort to reduce possible exposure to coronavirus while you're out casting your ballot, keeping people safer. And whether or not you have the day off, it's not too late to vote in Illinois, even if you have never registered to vote before. Please make your voice heard. Just go to a polling place near you and you can register to vote right there and vote in person today. Just bring 2 forms of identification, at least one of which shows your current address. For more information, visit the website of your local election authority or the Illinois State Board of Elections at www.elections.il.gov, elections.il.gov. If you still have your vote-by-mail ballot and have not returned it, and approximately 500,000 of those ballots are still out there, and you want to vote in person, you can either bring your ballot with you and you can simply hand it over so you can vote in person instead, or else fill out your vote-by-mail ballot and bring it directly to your local polling place or to a secured ballot drop box in your area. You must do so by 7 p.m. Central Time tonight. Illinois is taking every precaution to make sure that this voting process is as safe as it is secure. At my direction, the Illinois Emergency Management Agency delivered to local election authorities over 165,000 containers of hand sanitizer, over 1.4 million KN95 masks, nearly 260,000 surgical masks, and 90,000 face shields. Most of those deliveries took place weeks ago so that local election authorities have access to all of the safety supplies that they need to protect voters this election. We're committed to making sure that every election authority in the state can allow every voter to cast a ballot safely and securely. If you're headed to the polls today, please don't forget to wear your mask and keep your distance. If a voter is experiencing problems at a polling place and wants to call someone to get guidance on their situation, they can call the Illinois State Board of Elections voter hotline at either 312-814-6440 in Chicago or 217-782-4141 everywhere else in the state. If anyone encounters election activity that they suspect is improper or illegal in Chicago and Northern Illinois, they can call the Illinois Attorney General's Office hotline at 866-536-3496. Voters in Central and Southern Illinois can reach the Illinois Attorney General's Office at 866-559-6812. The Illinois Attorney General's Office also has a 2020 voter guide with frequently asked questions on its homepage, on its website at www.illinoisattorneygeneral.gov, that's G-O-V, illinoisattorneygeneral.gov. Please remember that if you are in line to vote at your voting place at 7 p.m. tonight, when polls are scheduled to close, you have the right to continue waiting and cast your ballot. As of this morning, approximately 3.8 million Illinoisans had cast a ballot, with nearly 2 million ballots being cast in person and more than 1.8 million ballots submitted through the mail. According to data from the Illinois State Board of Elections, a surge in vote-by-mail ballots accounts for the greatest difference between the votes cast so far in the 2020 election and the comparable time during the 2016 election. More than 1.5 million more voters have already cast a ballot compared to the same time during the 2016 presidential election, and that's pretty great. With vote by mail hitting all-time records, that means that we will have to be patient about the results of all of our races this year. It's possible, maybe even likely, that we won't know the outcome of the presidential election tonight. As I mentioned yesterday, this waiting period is a great time to take a break from social media. We know there are foreign state actors, specifically Russia and Iran and others, who intend to promote disinformation and misinformation today and in the coming days over social media. They would like nothing more than to promote conspiracy theories and sow discontent in an attempt to pit Americans against one another. If you want accurate information about the vote count, go to your local election authority's website, to the Illinois State Board of Elections website, to dedicated sites like 538.com or the election coverage section of the Politico website or the New York Times website, where they track all the races nationwide, or visit other reputable national and local news outlets. Remember, political candidates do not count votes. Political parties do not count votes. Television networks do not count votes. State and local election authorities count votes. They then transmit this information to the media and to the general public, a long-standing and standard process across the nation. With the record-setting use of vote-by-mail ballots here in Illinois because of COVID, we can expect to get results on probably Wednesday or Thursday or Friday. And there will be an official finalized tally of votes announced by November 17th. That's in accordance with existing state law. And just as with every election, states will be working hard this year to make sure that every eligible vote that was turned in on time is counted. On a different note, today is also a great day to take advantage of the open enrollment period for quality health insurance provided under the Affordable Care Act. If you're one of the millions of Americans who already purchase your own health insurance through the ACA Health Insurance Marketplace, or if you formerly had job-based health insurance but no longer do, now's a great time to find a new plan for you and your family. Also, you can always access a special enrollment period if you leave your job for any reason and need a new source of health insurance, another right that comes with the Affordable Care Act. Since its passage in 2010, the ACA has been an invaluable asset in Illinois' fight to provide health care to all residents of the state. According to the most recent data in 2019, approximately 1 million Illinoisans currently receive some form of coverage either through an ACA marketplace plan or through Medicaid expansion. Illinois residents can visit getcoveredillinois.gov, and I'll say that again, getcoveredillinois.gov, between November 1st and December 15th to learn about the best options, prices, and financial help available to you. My departments of insurance and health and family services have collaborated on making that website the best place to start your application for health coverage. Financial help is also available for ACA marketplace premiums for those who qualify and for those who qualify for and enroll in Medicaid. Private health plans with no premiums or copays are available too. ACA Marketplace and Medicaid health plans cover doctor's visits, specialists, hospital stays, mental health care, prescriptions, and more. If you need help with the process, again, getcoveredillinois.gov can connect you to free local assistance from a real person as well as translation services if you need those. Voting and healthcare alike have been made all the more important in this pandemic. So as I hand it over to Dr. Ezike for a medical update, let me remind everyone that every region of this state has exceeded the criteria for tightened mitigations because we are in the middle of a COVID storm that appears to be sweeping the entire nation, and our trajectory is only getting worse. This is far from over. So please take extra caution, wear your mask today and every day going forward until we get through this. So thank you, and with that, I'd like to turn it over to Dr. Ezike.
Good afternoon, and again, happy Election Day. Give you a brief update. In the past 24 hours, 82,435 tests were reported for a total now in Illinois of 7.9 million total tests. Overnight, 3,594 people were in the hospital with COVID-19, and of those, 755 were in the ICU and 326 were on ventilators. Today, we are reporting 6,516 new cases of COVID-19 in Illinois, including 68 lives that were reported as lost. To date, a total of 430,018 confirmed cases have been reported across Illinois and 9,878 total deaths. Just another friendly reminder, as the governor has said, if you are on your way out to vote, please wear your face covering. Please, again, make sure that it covers both your nose and your mouth. And practice social distancing. Wash your hands and use hand sanitizer. Also, please make your choices before you go in so that you can go in and come out as quickly as possible. Thank you. Hola y buenas tardes. Feliz día de las elecciones. En las últimas 24 horas, más de 82,000 pruebas fueron hechas para un total de 7.8 millones pruebas. Desde anoche, 3,594 personas en Illinois estaban en el hospital con COVID-19. De ellos, 755 pacientes estaban en la unidad de cuidados intensivos y 326 personas estaban en ventiladores. Hoy informamos 6,516 nuevos casos de COVID-19 en Illinois, incluidas 68 vidas perdidas. Hasta la fecha se han reportado más de 430,000 casos de COVID-19 en Illinois y más de 9,800 muertes. Un recuerdo para todos: si vas a ir a votar, por favor, use un cubrecara, mantenga su distancia y asegúrese de que su boca y su nariz estén cubiertas. También lávese las manos o use desinfectante de manos. Otro recuerdo: si recibe la noticia que sea infectada, recuerde que se necesita hacer en cuarentena por 14 días. Muchísimas gracias para su apoyo. And with that, I will turn it back over to Governor Pritzker.
Thank you. Thanks, Dr. Ezike.
And then go online.
Okay, I have two questions. Thank you, Governor.
Hi.
If Biden wins tonight, we've been told that Mayor Lightfoot.
At what, I'm sorry?
Oh, I'm sorry. If Biden wins
Oh.
tonight, we've been told that Mayor Lightfoot may be heading to the Department of Justice. Have you been courted for any possible cabinet positions or ambassadorships?
No.
No? Okay. My second question: where are you going to be watching the returns tonight? And what will happen if your graduated income tax is not passed?
I'll watch returns at home. I would encourage people to do that if they're watching the returns. And look, I'm optimistic about the results of the election for the fair tax. And I don't know that we'll know the results of that election tonight. It'll take some time. As you know, there's a method of calculating how many ballots were turned in, how many people actually voted on it. Those all matter in terms of what the necessary numbers are. Illinois without the fair tax are not good. The options, as I laid them out at the beginning of this effort more than a year ago, are significant revenue increase on a very regressive basis. The way that the Illinois income tax is currently charged, it is significantly regressive. It benefits the wealthy, and it hurts the middle class and those who are striving to get there. And, and there's no doubt that Illinois would need revenue in addition to obviously looking at cuts in state government as we have. The cuts, though, just to be clear, 15% cuts in public safety dollars, education dollars, in the dollars necessary for human services, exactly at a moment when people need these things most. And so the alternatives are not good. That's why I proposed a third way. I didn't think that either one of those seemed like a good idea. And so, that's why I've advocated for a fair tax system in Illinois.
I just have one last question. Okay, thanks, George. We've gotten a number of phone calls, people into our station that said that infected patients are still going back into nursing homes. On the northwest side, there is a facility, a lawn care health facility in Naperville, where paramedics say they transferred 23 infected patients back into nursing homes. Are you encouraging nursing homes to take back infected patients? Is there an order or edict?
No.
Or any incentive through the state reimbursement from IDPH?
Oh, no.
So is it up to the director of the
It's
nursing
up to
home?
the doctors in the hospital to determine that someone is well enough and that they're not shedding the virus to determine whether they should be discharged.
All right, Mike Militich is asking, despite COVID-19 mitigation guidelines, several election night watch parties are planned inside bars and restaurants and large crowds are expected. Are there any plans to address the large gatherings with enforcement efforts at the state level?
Well, let me start by saying that local officials, local law enforcement should be standing up and enforcing the rules in the state. And you know why? Because weeks from now, when people will end up going to the hospital as a result of these gatherings that are being allowed and are the failure of enforcement, that those local officials and people who live in those areas will be coming to the state to ask us, what are we going to do to add hospital space when the hospitals are full? And of course, we're going to do everything we can, but it's these local officials, if they don't do their job, then we're going to end up with hospitals having to turn people away. And that's just not something that I find acceptable, and that is why local officials, that is why people all across the state, need to stand up and make sure that they're doing everything that they can locally, state's attorneys, sheriffs, law enforcement, elected leaders, to enforce the rules here so that we don't end up with a terrible nightmare of a healthcare situation and people dying because they can't even get treated in their local hospital.
Shruti Bloomberg is asking what public safety precautions are underway in Illinois for the election. Has the Illinois National Guard been deployed?
So we've been in contact with virtually every law enforcement agency in the entire state. We have the state police, of course, which are the best in the nation. They are on duty. And the Illinois National Guard has been put into a state of readiness just so that they, if needed by local officials, they could respond relatively quickly.
Jim, Brendan, Dave, all in Springfield have the same question. Springfield and Sangamon County announced today that they will allow indoor service to continue at 25% with some other limits. What's your reaction to their plan that defies the state mandates?
Well, see my earlier comments. The fact is that local officials who are not doing the right thing are the ones who are going to be responsible for the rates of infection going through the roof and our hospitals getting overrun and people are dying if they don't enforce the rules. That is why those rules exist. We didn't make them up. The doctors all over the world have put forward studies, and it's very easy for you to find those. I've provided them to every official who has asked for them, and frankly to every media outlet. We know that the places that are remaining open, that are having large gatherings and defying these rules are, in fact, spreading locations. These are places that are amplifying the virus across the state. And so, when you've got double-digit positivity rates in your area, as is the case in Springfield, then the local officials need to take the laws that are on the books and the regulations that we've put forward and the orders that we've asked people to follow and enforce them locally.
Jim Haggerty at the Rockford Advocate. It's been a while since we've heard much about therapeutics. Have any available drugs used to treat the symptoms of COVID-19 helped keep any of our hospitalization numbers down?
It's unclear to me the level of usage of remdesivir, which I've been talking about since the very beginning, but I know that that is one of the drugs that the medicines that's been used in a number of cases. Having said that, there is also a factor involved here where doctors have simply learned about some of the things that they can do with medicines that are already available to them. For example, blood thinning medications, which have been very helpful in saving people's lives. But I should turn it over to a doctor, and I happen to have one right here with me. Dr. Ezike, do you have anything to add?
Just quickly. So, of course, as we mentioned, remdesivir is listed as a treatment we have seen from the studies that it decreases the days of hospitalization. So it's not a be-all, end-all cure, but it can shorten the duration of a hospital stay. We know that there are other drugs that are going through the FDA process now. Many of you heard about Regeneron. We do know that dexamethasone, which is a steroid, is becoming part of a normal course for hospitalized patients to prevent some of the significant sequelae that can happen regarding to a pro-inflammatory response. We do know it's not a cure, but we are starting to appreciate just the benefits of just vitamins. I think many of us maybe do not have our ideal daily dose of vitamins through our regular diet. So supplementation with vitamins, vitamin C has long been known to support immunity and fighting infections. We also know, we've known vitamin D is also an important adjunct in terms of promoting immunity. And living in Chicago, where we might get less sun than other places, vitamin D is usually low in people who have less sunlit climates. So those are things, just optimizing your basic health, obviously, is a great way to move forward. And as more things come online, we'll be happy to share. But of course, remembering, since there is no be-all, end-all cure, still we want to go for prevention. So let's prevent the infection so we have to worry less about treatment. And then again, that just comes back to our mask, avoiding large gatherings, washing our hands, and keeping our distance. An ounce of prevention is worth a pound of cure.
Thanks, everyone.
Thank you.